We're also blending our pre-K funding, which is lottery funding in the state, purely lottery. We serve 84,000 children. Funding for the upcoming year is $313 million. The way that we have used this in particular to hit at-risk children is through our Head Start program. We are intentionally blending Head Start and pre-K classrooms so that our funding can actually be used to fund the academic day, and the Head Start funding is then used for wraparound services.
In 2005, in the summer of 2005, a group of Louisiana leaders, including Dr. Nagel from Tulane and Child Care Resource and Referral, the State Department in terms of social services, went to Tennessee to talk with them about the quality rating system. The very next week, Katrina hit New Orleans and the Gulf Coast, and lots of things changed for a number of months and years. Following the devastation, though, people looked around and said, what can we do? How do we continue work? How do we improve what we've not only been left with, but where do we get back to where we started?
Last year, our tax credit that we received was over $68,000. So it is a lot of money, and it really does help centers to improve the quality of their center. And then the parents get a tax credit. The parents are now looking for the centers that have the stars because they know that they can get a bit of money back. And I know that one of our parents received over $3,000 back. So parents really benefit when they look for centers that have the stars. So the tax credit is really working at Broadcastle. Like I said, it has changed the look of my center. Before, I used to serve just children, a lot of low-income children, but now people who typically would not look at our center is now looking at Broadcastle.
At this point, I think we're around $6 million in the first 2 years, and I am spending a good deal of my time out talking to partners in the community to explain what quality rating is, but also to ask for their assistance and money. And we have gotten a great response. Gears has assisted us in bringing together a group of 16 funders who are interested in early education. And we meet with them on a regular basis to talk about the progress that we've made and the needs that we have.
We know from providers that some of the processes related to the tax credits have been cumbersome, if you will. And so it really is, this is the right time and the opportunity. We look forward to the chance to work with not only stakeholders, but our partners in the Department of Education and the Department of Health and Hospitals to really redesign and figure out in what ways that tax credit can be used to support ongoing improvement in the system.